A very good afternoon, and I welcome all the participants back to our S.H.A.R.E webinar series organized by Karnataka Homeopathic Medical Association. Now I request Dr. Niranjan Kurkimat, our General Secretary, to welcome today's gathering. Over to you, sir.
Good afternoon, everyone. Hope all are doing well. On behalf of Karnataka Homeopathic Medical Association, as a General Secretary, I would like to welcome today's speaker, Dr. Manjunath sir, Deputy Director of Homeopathy, Department of Ayush, Government of Karnataka. I welcome Dr. A.L. Patil, former Ayush Director, Government of Karnataka. I welcome Dr. Veera Brahmachari, our President, our Working President, our Vice President, Dr. Jayan. I also welcome all the office bearers of KHMA, doctors and students. Thank you. Over to you, Dr. Bharat.
Thank you, sir. Thank you, Dr. Niranjan, sir. Moving on to today's session, as you are well aware, today's speaker is Dr. H.A. Manjunath Kumar, sir, Deputy Director, Homeopathy, Ayush Department, Government of Karnataka. Sir, he has done his GCEH in 1985 from A.M. Sheikh's Homeopathic Medical College, Belgaum, and he completed his post-graduation from GD Memorial Homeopathic Medical College and Hospital, Patna. He joined government service in the year 1987, served as a medical officer in Somwarpet and Parane in Kodagu district, served as grade 1 physician and RMO in Government Homeopathic Medical College and Hospital, Bengaluru from 2005 to 2021, served as a district Ayush officer in Kolar from 2016 to 2018. Now at present, sir is working as a Deputy Director of Homeopathy in Department of Ayush since August 2020. Apart from this, sir is also into extra activities. He is a known national master swimmer, South Zone champion in 2008. He is also a Reiki healer, hypno and yoga therapist, state medical coordinator for Samarpan Medical Group, also a music director, lyricist, vocalist, editor for spiritual literature. So he is also a coordinator and speaker for All India Radio and TV, and he has conducted more than 120 programs on homeopathy for All India Radio during the year 2011 and 2012 through Ayush Department, which is a record in history of homeopathy. And he has also delivered hundreds of speeches on spirituality throughout the state. Also trained thousands of doctors, policemen, and public in meditation workshops too. So this is a brief introduction about sir. Coming to today's topic, approach to cases, a glimpse. So now I would request Dr. Manjunath sir to take over. Yes, sir.
Thank you, Dr. Bharat. And very good afternoon to everybody. My topic today is the approach to cases, a glimpse. Actually, everyone knows as homeopathy deals with classical prescriptions, classical method of training is given, and thereafter we practice classical technique. So classical technique may be general to particular, particular to general. With my experience, I am in the field for the last 42 years. With my little experience, actually a physician becomes well versed with the subject with experience. Though we study many years in the colleges, and when we come out from the college, we are brand fresh, new to the field. When we go on practicing, we get certain knowledge from the clinical aspect. Our remedies are proved, reproved, clinically verified. There are so many symptoms which are added when we do the clinical verification. In the clinical verification, we go on collecting many things. So such things, I feel, if a physician shares with the other brothers, of the field, it will be some help to the doctors. I am happy and satisfied with my little experience. If someone can use my technique or what I am going to express today, if it is of some help to the homeopathic field, I am satisfied and very happy. So, why did I take this approach? Because generally we treat classically. When the case comes to you, the third point here, what I have kept is state of the disease. Am I audible? Am I audible?
Sir, yes, sir.
Yes, sir.
Yeah, fine. The state of the disease, I mean to say, we have to discriminate when the case comes to us. Other school doctors are also practicing. To their level best, they will be trying to cure the diseases. But unfortunately, homeopathy has a leading status in curing the patients. Whereas other school people, especially modern science, many a times manages the cases, but curative line of therapy is not possible by the modern school. Not in all, but in many of the cases. It is our duty to discriminate, as I say. We have to discriminate the cases, whether it is surgical or it is curable under the line of therapy, medical line of therapy. Surgical, I mean to say, is not surgical according to homeopathic doctors. All the cases which have been announced as surgical or discriminated as surgical by the modern school people are not surgical for us. In spite of it, we have very good remedies wherein we need not have to send the patient for a surgery. If by chance we decide our remedies cannot do anything at this stage and we are supposed to send the patient to the hands of surgeon, then according to me, that is pure surgical cases. So such a surgical cases we cannot treat. There one level of discrimination has to be done. Then when the cases come from the other schools, hands of physicians of other schools, so much of drugging is there. So far what we have iatrogenic diseases study is insufficient according to me. We have to open a field and a subject has to be raised and we have to study under which all the iatrogenic diseases. Many cases comes to us with renal failure. The modern school people only, they diagnose it as medico-renal failure or any other diseases. By using many of the drugs which are which don't go on well with the kidney or liver, in such cases, so they land in problem with the because of the drugging. So such cases are complicated. All the cases who comes to you are pure and uncomplicated with drugging. Therefore, I say we have to discriminate whether it's a pure case or drugged. This is the second level of discrimination. One more level is there, that is out of margin. It has to be added, but still, whether it is possible by us or no, can we handle the case or no, is another margin. So first, we decide we can take this, it is not surgical. We think that we can cure the case and we can take it. And whether it has come from the hands of other doctors, other school doctors, or from homeopaths. If it comes from homeopaths also, we have some obstacle for cure. That also be borne in the mind. Hence, I have taken today's different approaches to cases. As we are taught, take the case, give a select a simillimum, prescribe, is insufficient according to me. As the case comes, we are supposed to find out in what state the disease is. From there, we have to go ahead. Pathophysiological basis, I mean to say, when the case is complicated, you study the pathology, and what physiology should have been is not there now. To prescribe from general to particular or particular to general in a classical way, we require a pure case. To clear it, as said in our homeopathic literatures, you can prescribe anti-miasmatic single remedy, one dose, and wait for some time till the picture clears. In spite of it, many times you require to muddle the case to make it pure. I have few cases further which will explain you clearly where I have cleared the pathway for the classical prescription later on. So that is approach according to me. Miasms, initially we have to decide whether we can go on the constitutional base, anti-miasmatic line, or any other. If the case has come from homeopathic hand, if they have treated already, whether we are supposed to give a chronic one, which can be dealt under second prescription. There are so many varieties of prescription. So all these things have to be kept in mind. So when we study the pathophysiological base of the case, it's very helpful for us to know the prognosis of the case. The suppression of the case can be possible. You will come to know whether suppression is going on or no, or prognosis on the right, correct direction. If the cure is taking place in the right direction after the prescription, then also pathophysiological base will help you initially to have the approach. Where are the lesions? When we study pathologically, say for example, you study X-rays or CT scans or endoscope, colonoscope, you get the picture. Where is the lesion? What has taken place? What is the miasmatic basis of the case? You all know functional changes is S.H.A.R.E, the collection is psychosis, and the destruction is syphilis. So therefore, I would like to add here that we are supposed to study the pathological base of the case also. Then it will tell us to discriminate whether it is curable or incurable. In so many ways, it is helpful for us. So we can decide the case in what stage it is, from where we are supposed to enter in and prescribe. So location-based, this is something called as location-based prescription also. So it will help you to select a remedy with the location. Next, maybe organopathic approach may be needed, or anti-miasmatic line of therapy may be thought of. Sometimes based on the laboratory investigations. If you purely stick on to laboratory investigations, it's wrong. But it has to help you to understand where the case stands and what it is and what to do further. Tautopathic, doctrine of signature. And when you do the therapeutic diagnosis, that also gives some hints to the prescription further. Don't purely depend upon these points, but these are helpful for the approach to the case. I have one example under therapeutic laboratory investigation also. Sometimes if the case is incurable, then we have to think of palliative. There are a few more approaches, but still due to restriction of time, I will handle with only few cases. Today, I deal with 4 classical cases, 5 pathophysiological based cases, and 1 on laboratory investigation, that is after diagnosis of the nosological diagnosis of the case. This is a case. A 17-year-old girl, I was observing her tongue. Tongue takes the imprint of teeth. It is slightly moist and thin white coating is there. When you study a face, you can study many things. You can look into her hairs, forehead. There are so many things. Sorry, it is 27 years old. Miss Yes, aged 27 years old, pain in abdomen. She came to me with pain in abdomen since 3 months. The location was right iliac fossa. Pain was worse, eating, drinking, even drinking water also. After the food gets digested, also has low back pain at right side. Bilateral renal calculi also she had. So it was confusing whether the pain is due to renal calculi or right iliac fossa. Is there any pathological base? Abdomen gets bloated after eating. Feeling of heat in abdomen and right lower limb. Pain in right lower limb, nausea and eructations, epigastric discomfort, was taking tablets too. She used to take some tablets for pain in the abdomen. So that used to aggravate her condition. Tongue thin, white coated, imprint, takes imprint of, it has taken imprint of teeth. Headache, she had also along with this headache was cold weather, wind and traveling. No thirst. Stool was constipated. Actually, her bowels were constipated. Urine, menstrual cycle, nothing abnormal detected. Colonoscopy revealed terminal ileal aphthous ulcers. Terminal ileal aphthous ulcers. Histopathology, so said terminal ileitis, no appendicitis. Appendicitis was ruled out. The pain was so much, so severe when she came to me. So I had to think of appendicitis too. I decided it as, diagnosed it as initial stage of Crohn's disease. Initial stage of Crohn's disease. So this is her colonoscopy report. Normal multiple scattered aphthous ulcers with the surrounding mucosal edema and erythema noted. To decide a remedy, I took few items. Location, right iliac region. She had, along with that, she had headache, epigastric discomfort and constipation. When you think of right iliac pain, suddenly a remedy flashes in the mind is iris tenax. To rule out whether it is iris tenax or no, the salient features of iris tenax has to be thought of. She had nothing of the throat or tongue dryness was not there, throat burning was not there. So that was not there, but still headache was there, epigastric discomfort was there, constipation was there, and the place was right iliac region. Hence, prescription, I based it on the location, along with the other help of the other symptoms. Iris tenax 200 TID 5 days on 14/11/2021. He came back on 21st of same month. Pain was better only for 10 minutes after taking the medicines. Again, it used to come back. I thought of repeating it in a shorter interval. Repeat every 2 hourly for 3 days. She came after that on 26th, felt much better. Then I gave PL for her for a week. Still she was feeling better. PL continued. In January 2022, again slight pain occurred with pain in lower limb. Was eating. Iris tenax 200, SOS, 1 dose if pain appears. So she started feeling better. Further, once or twice she had come to me. Now she is on observation. So this is on location. This approach was actually from the location, along with the other symptoms. I don't say prescribe only on the basis of location, which is not correct, but that has given me a good thinking. From there, I could succeed. Considering these things, out of my experience, I have collected a picture here. When you have pathology in the lower end of esophagus, ipecac, naxomica, carbohydrate, alumina, arsalb helps a lot. Condorango, little lower. Condorango, phosphorus, abysnager, still in the first part of the body, and maybe still further. Naxomica, carbohydrate, ipecac, calicarb, like that. When you go to the duodenum, anacardium and other remedies, in the lesser curvature, ornithogallum. I mean to say earlier we used to get the barium meal X-ray. With barium meal X-ray, we used to get the correct position of the ulcer, gastric ulcer, that is especially of the gastrum. Duodenal ulcer, especially of the gastrum. If it is in the duodenal area, these are the remedies which are helpful. I don't say prescribe purely on the location basis, but this will lead you to few remedies. Thereby you can eliminate the other remedies and go on with this. If other symptoms suit, Definitely you can prescribe. I have succeeded with many cases by doing this. Now let's go to second case. This gentleman, aged 42 years in 2009, came with Ryle's tube attached at right hypochondrium. I'll show you another picture where it was attached. Came with Ryle's tube attached at right hypochondrium. He was fed through that using 10 mm 10 cc syringe. A kanji was prepared, and his wife used to feed through the Ryle's tube. Nothing through mouth. Lean, thin, emaciated, very weak, no food through mouth. Had gastrointestinal obstruction, hence underwent 2 operations. He had eructations and contents of the stomach not getting emptied further. GJ was done, gall bladder removed, problem still remains. The modern school people thought that stomach is like a funnel, and if you perform GJ, the contents of the stomach should get emptied to the intestines, but which was not happening. Can feed only on liquid foods through the Ryle's tube. Mentally strong, well behaved, but will not leave the doctor if doctor doesn't explain him what is wrong with him. He will take the doctor left and right. Doctor, tell me what is wrong with me. What are you going to do? All those. What medicine you are giving me? What it is going to do on me? All those questions he would put. On the basis of symptomatology, initially we gave him carbo-vegetables 200. As he was feeling slightly better by eructations, mainly. Nothing much could be traced out. Followed by Naxomica 200 on the basis of weak peristaltic movement. Still, contents of the stomach are not getting emptied. The modern school people thought that if they perform GJ, the content would get emptied. I thought the peristaltic movement is weak, hence I gave Naxomica also. But it did not help. What is the underlying cause? Now the approach comes. The approach to the case should be proper and find out what the underlying cause is and clear the picture first. When the picture is cleared, we can prescribe on the basis of symptomatology. A classical prescription can be made. I advised him for the 3rd operation. Why? At this stage, I could have prescribed some medicine and waited for some time. I had something in my mind. By looking at his case, studying it at his case, I had something in my mind. Hence, I advised him to undergo another operation. Why? See, this is where in the left hypochondrial region, this is after the 3rd operation. He felt better and thereafter I took the photograph. He had a Ryle's tube there. I wanted to remove the Ryle's tube first, one thing. But still the stomach is not emptying its contents. What could be the underlying cause? We think of intussusception, diverticulitis, CA, or any other obstruction inside. Acute abdomen, it is not acute abdomen because since many months he is suffering from it. So all these things, those things were ruled out by doing scanning and many things. I had many supportive documents for it, which I am not producing here. So those things were ruled out. Still, one more thing was in my mind. That was adhesions. He had undergone 2 operations. After 2 operations, we have a lengthy small intestine. Small intestine, if it gets adhered to the other structures there, it cannot move the contents from there onwards. So I wanted to clear off the adhesions. So adhesions, clearing adhesions with homeopathic medicine may take long time, and this has been meddled with the surgeons, other school physicians and surgeons. When the case is meddled, I wanted to make it pure first, give him relief and see the function, physiological function is going on well. Then onwards we can prescribe and we can prevent again adhesions, and we can allow him to eat through the mouth. This was a surgery 3 times done. Therefore, you see the scar there. Now, to prevent adhesions, calcareous floor 6X was given with repeated doses immediately after the operation. I asked anterior floor fixes and I wanted to give it because to avoid the adhesions. Adhesions were avoided. Thereafter, he started feeling better. Later on, we have very short time, I think. It will end in 10 minutes. I'll go a little fast. See, this is another case. Couple had come few years back to me. So married for 7 years and there was no issue. Miss YD, age 25 years, 9/6/2018, married for 7 years, had PCOD, IUI tried and failed even with donor. MC irregular after marriage with increase in weight. Now periods not occurring without hormonal tablets, periods were not occurring. MC 4 to 5 days, out of 90 to 120 days she used to have periods. HSG normal, sexual interest reduced, craves for sugar, HP percentage low, has syncope. Hormonal impairment was there and health upset, still no issue. On 9/6/2018, depending upon the organ, I selected Ufornum 1M. I gave for 7 days, followed by Pulsatilla 1M for 7 days. To clear off the hormonal and what she has already fed with hormonal tablets, the side effects of which I wanted to clear, and I wanted to stimulate the her ovary to release the ovum. So Ufornum for 7 days, followed by Pulsatilla 1M. On 23/7/18, energy level improving, had menstrual cycle on 26/6/18. Immediately after that, she had, I repeated again, conceived and had a female child, now 18 months old. Within 2-3 months, she conceived. And look at her husband's problem. Another pathophysiological based case. Her husband, Mr. STF, aged 34 years, obesity, high cholesterol level, hypertensive, habit smoker. Semen analysis is important here. Progressive, slow in linear 42%, immotile 58%, morphology defective 99%. Therefore, they did not succeed earlier. Normal was only 1%. Morphologically 99% defective and only 1% was normal. On 6/9/2018, I prescribed Beretta Carb 1M for 7 days. On 23/7/2018, small rashes he started developing on his genitals. No itching. Sulfur 30 for 7 days was given to him. Next visit was on 6/11/2021. They came in 18. Now after that, they came in 21. Till then, I was not knowing that she got conceived and has a baby. He had met with some accident. He came with a female baby plus a complaint of swelling of left foot after an accident. When they came for treatment of that swelling of the foot due to accident, I came to know that they had an issue. So it was a good case. Case number 5, Mrs. GM, aged 48, fears that her husband will die, the water in all the bore wells will dry in her area, and the police will take her away for the house loan. Since 2 years, this was going on. She had a anticipatory fear. No use convincing her. I tried to convince her, but she was not agreeing. No, police will take away me, she was telling. Lazy feeling she had, used to eat Vibhoothi and Arecanut. Hair fall was there, patchy rashes on her upper limbs and palms with itching. See her vertex there, hairs are not there. She had rashes on her forelimb. And anticipatory, I took the symptoms like this: anticipatory fear. Lachesis and nausea are two leading remedies. Nausea broods constantly over imaginary troubles and aversion to talking, suicidal insanity. Whereas this patient was quite talkative. She had no aversion for talk. And she was in climacteric almost. Suspicious, jealous, talkative are the leading symptoms of lachesis. She was not suspicious, jealousness was not there, jealousy was not there. But still, I preferred lachesis and prescribed on 7/11/2018 lachesis 1M for 3 days. On 25th of December, she came, no fear at all. She was smiling. When I asked her, you were telling all these things earlier, no? She was smiling. No, nothing of that sort is there in my mind, she said. So alopecia areata was persisting. Skin rashes was also persisting. Sulfur 200 was given for a few days. On 13/4/2019, hairs growing, skin rashes persist. Now Rashes on thighs also she developed. Clearing above downwards. Rashes from hands. See the picture now. She's improving. Much improved. Almost full hairs. Total hair has come back. And these rashes, what she had earlier, now you can, if you can appreciate, can see the picture there. On the right hand there at elbow and no rashes on arm and forearm. Rashes on palms almost healed. Healing above downwards, Herring's law. Almost cured. On 1610, yeah, same thing what I told you just now. Again, I had given sulfur 1 mg, few doses. Another case, Mr. S, age 53 years, admitted to hospital with COVID positive severe symptoms and remained there for 40 days, 22 days in ICU. CT score was 24 out of 25. This is most important, 24 out of 25. And on oxygen support when discharged. Advised to take home as the case is hopeless. Has breathlessness, worse motion, dry tongue, chest pricking pain, pulse 45 per minute. On the basis of symptoms, a few doses of Bryonium 1 mg were given. Later on, to clear the fibrosis of the lungs, acetic acid followed by thiocyanamide, acetic acid and thiocyanamide, which has the capacity to cure the fibrosis. So Bryonium was indicated initially to clear the respiratory problem. I am almost done with the cases. 1 or 2 more, 3 more cases, I think. So I should thank the KHMA, Karnataka Homeopathic Medical Association, office bearers, president, everyone, and all the members of KHMA for giving me an opportunity to speak today in this occasion to share my views and experience. Thanks a lot. Once again, thanks and bye for today. Over to Dr. Bharat.
Thank you, sir. Thank you very much. Within the short notice of time, you agreed for our invitation, and you were very ready to present for today. Thank you for the approach of cases in different aspects. I feel as a budding homeopath, as an early practitioner of homeopathy, we require all such experienced doctors to speak about their experience in various aspect and approach. Today you have taught us your experience. I think it was very short time for you to explain all the cases. In future, we would like you to share more such cases, and we would call you back on one more session. I hope sir is ready for that, sir.
And, fine, really, thank you.
Yes, sir. So I thank Dr. H.G. Manjunath, sir, for conducting today's session. Thank you very much, sir. I also thank Dr. Veerubrahmachari, sir, our president, KHMA, in organizing today's session. I also thank Dr. A.L. Patil, sir, former director Ayush, in joining today's session. I also thank our General Secretary, Dr. Niranjan, sir, and also all the office bearers of KHMA for attending today's session. And at the last, I also thank all the participants, the students, the PGs for attending today's session. The recorded version of this session will be uploaded in our KHMA YouTube channel as early as possible. We will come back with one more session of S.H.A.R.E series. Thank you. Thank you and good day to all. Thank you all.
Thank you.